Welcome to Courageous Conversation with Teresa W. Gamble, a cultural storytelling, gracious space to bridge generational gaps through active listening and action-oriented changes.
Powered by Concierge Resource Professional Consultant.
So Elaine Brannon is still continuing the conversation with us, and also the founder of Revival Health and Wellness Council, her nonprofit. We are going to talk about her experience in her hospital in Nevada with this pandemic, especially with this Delta variant. So Elaine, tell me, what is life in the hospital now since this pandemic for you as a social worker?
Well, emphasis on social.
Okay.
And one of the mottos that I have is, I am too social to be socially distant. And that has been such a challenge,
right?
Because as a social worker, I come in contact with people, face to face with people,
right,
on helping them improve their level of social functioning.
Right.
So I've had to get creative.
Oh, wow.
With how I do that, so that they still could feel as if they have me present.
Wow.
So the first thing I do is I explain to people why I might not be in their face, why I'm on the phone,
right,
or why I'm on a Zoom call.
Right.
Or why their family member, oh, Elaine, can I just come and see you? A family member, I just got to come and talk to you. Why I may be talking to them in the lobby. Both of us masked up, we're at a distance.
Mm-hmm.
In our hospital, as I'm sure in most, when you walk into the threshold of a patient's room, there's a tape.
Okay.
And you're encouraged to stay behind that tape, because then that is a social distance between you and the patient.
Wow.
My interactions with staff sometimes is limited because I got a team with my nurses.
Right.
I have to give report. They're getting report. Shifts are changing, so we got to know what's going on with patients. And a lot of times I'm not face to face with them. I'm on the phone. We have team huddles at 10 o'clock every day, where our doctor gives us a rundown of every patient and then gives us our marching orders from then as to what he or she is ordering us to do. And I'm sheltering in place in my office, so I'm on a Zoom call.
Wow.
And I'm taking notes, and I'm trying to make sure that I get everything down with who's being discharged and what they need and how to get it to them, all without having that physical contact with them because of their safety and mine. And when I am having contact with my colleagues and with my patients, I'm rushing and I'm letting them know. The other day, I went to a room behind the threshold so I could tell a brand new mother who had delivered her baby some information that I couldn't tell her over the phone.
Right.
And she was holding her baby, and I said, in about a year and a half, this is probably only the second baby I've seen.
Oh, wow.
And I work directly with our labor and delivery department because I don't see the babies. And when I'm handling a discharge with the new mom, I have her on the phone. I can hear the baby cry. One time I even, just for my own sanity, the baby was crying, and I asked the mom, do you need to attend to the baby? So I can call you back. And she says, well, okay. And then I said, well, you know what? Instead of me having to call you back, just put the phone down. And then when you tend to the baby, and then, you could pick the phone back up. And then when she picked the phone back up, I thanked her for that. And she's like, what are you talking about? I said, you know what? I'm going to be upfront. I did that because I wanted to hear your child.
Wow.
Because I haven't had that experience to see a new mom, especially a new mom that I'm helping with some resources and things. And I haven't been able to have that interaction. My office sits near the main entrance of the hospital. So sometimes, and I have a window on my door, and I have my blind up. And sometimes I'll ask them, call me when you get ready to leave so I can see you coming by, and I'm waving, or they put the
Right.
baby up to the window.
Aww.
So it's been difficult because of the nature of my career.
Right.
And the contact that a social worker really needs to have with people. My supervisor, who's the chief nursing officer, always talks about how I think outside of the box. And so without even knowing it, I've gotten really creative on how to interact with my patients so that they have a good experience, so that they feel comfortable at their discharge, knowing that they have the resources they need when they leave.
Right.
But without having that physical contact with them.
Wow, that is amazing. I bet that does take an emotional toll on you. So with that during the pandemic and with this increase of the Delta variant, and you said earlier that in your hospital, you're the only social worker. How are you able to juggle your roles and responsibilities, be socially distanced from your patients? And the numbers are constantly rising with new patients every day. How are you able to do that?
I think routine is the most important thing. A routine I have before I get there, and then a routine that I keep in my mind while I'm there.
Okay.
And because of my background as a social worker, I feel like I'm an expert in how to pivot it. Because I can come in there one day thinking, like right now, I can think about what I want to do when I go back to work, what's on my desk, and what my plan is. But before I can put my purse down, sometimes I'm getting a call.
Wow.
For a consult. And I may not know what the consult is about until I get there.
Right.
Because as a social worker, I've been trained not to have a big long debriefing before you just like face to face with the issue with the patient. So it might be, hey, Elaine, this is Dr. So-and-so from the emergency department. I have someone here in bed 9 that really needs your help. Let me know when you're here and you'll just come by. I don't know who the person, I don't know their name. I don't know who they are, how old they are. I just walk in. Hey, Doc, you said you have somebody in room 5. Then they give me a little snippet. And then as they're walking me in to meet the person.
Oh, wow.
And then here's the big setup. Here's Elaine, this fabulous person that I've told you about this. She's going to help you. I'm thinking, I don't even know what they need yet. How I know I'm going to help. And then I just, get into my social work zone, knowing that, my role over the past 35 years have been to help people improve their level of social functioning. And I listen to what they tell me. And then we just team and figure out how to get their issue resolved and go for it. And I let them know. And if this don't work, just give me a minute, because I'm good at thinking about what to do next, or what to do next, or what to do next. So don't get wigged out if our crafted plan just don't work, because your son say he's not coming to pick you up from the hospital or whatever. We'll just figure it out, So I just kind of try to put the patients at ease, letting them know they're in a safe place. In the hospital, that we're a team of all different disciplines and we got this. So all you got to do, because you do have something to do, and that is be here and trust me, which sometimes can be hard. Right. But even if you don't trust me, just be here, because you be here, I'm gonna cut it on you. But just be here, and then let things flow, and it just works out. And if it don't work out, and the Lord let me breathe tomorrow, it'll work out tomorrow.
Wow, that's amazing. That's great that you can pivot on the fly, on the run. And during this pandemic and being in the role that you're in and providing these resources for your community at your hospital, how do you handle and deal with bias, racial bias from the patients that you're helping because of the political and the racial atmosphere that's going on in the middle of this pandemic? How are you able to handle that as a social worker?
Well, I will say even before the pandemic, because I'm a Black woman in America, I've had to deal with that. So I don't look at it as any different.
Okay.
And there have been times where not only in my role here as a hospital master social worker, but even in other public and private agencies where people have had to get over the racial barrier. And I say people have to get over it because I don't have to get over it. I am trained in my own family values, and in my professional world to help a person.
Got it.
And so because I already come with that focus, and when I train young social workers, I taught introduction to social work for 9 years.
Mm.
And actually I have a pizza party for the people that after they finish my class, they decide they don't want to be a social worker. We party hardy on the last day of school because I'm like, you have made a decision not to come in my profession, and I am so grateful for you. Because if you don't feel like you got what it takes,
right,
or you feel like after 10 years you're going to be cynical or anything like that, and you decide right now that you don't want in, good riddance, goodbye. There's enough people in here already that are like that. We don't need one more.
Right.
I'm happy for you. So because I have that ability naturally, and then I'm trained for that. And then I put a lot of effort into doing it too, because I'm not going to say that I don't get angry or I don't get frustrated or I don't get mad, but it takes some work for me to get an attitude adjustment and pivot and get it together. And I try to work with that patient who is projecting that onto me. Number one, to let them know that I'm gonna dodge it. You're projecting it here, but I'm gonna move. I'm gonna pivot. I'm going to bob and weave from it because I can't afford to get hit with that, because then I got to go to the next person and I don't need to carry that.
Right.
This is particularly difficult sometimes with dementia patients.
Okay.
I remember when I first started at the hospital, there was a gentleman that he was diagnosed with dementia. So we all knew that it was that. It wasn't that he was being manipulative or mean or nasty or anything, but he had dementia. And I walked into his room and he asked me, how did they let me in?
No, he didn't, Elaine.
He asked me, what am I doing there? And how did I get in there? How did they let you in? And I said, what do you mean? Because even though he has dementia, I know, he could say what he meant. I was like, so, because I've dealt with dementia patients all the time, so I know how to communicate with them a little bit. And I said, well, what do you mean? How did they let me in? And then he got to talking. And he talked as if he was in 1919.
Oh, wow.
Because he was born like 1920, something like that. And he was going on, and I just let him talk. And he was telling me about his ranch. He was telling me about some of the sharecroppers that were on his farm. He told me all kind of stuff. And he says, and this is a nice hospital. And you shouldn't even be here. And then he started whispering, are you sure they let you? And I said, you know what? They told me I could be here. In fact, they asked me to come in here to help you with some things and to talk to your daughter, because he remembered who his daughter was. And so I said, so yeah, they let me do. Oh, okay. And I said, and because I went to school. Wow. He's just going on and on. And so when I left out of the room, the nurse did tell me, because this was a nurse that was non-white, but she wasn't Black.
Right.
And she said, she was fuming. her face was red through her brown skin.
Wow.
She was hot. She says, I can't believe he said that to you. And she was going on and on. And I said, well, first of all, he doesn't know.
Right.
And the way if I had dealt with him in any other kind of way, because of his fear of uprising of people like me,
Mm-hmm.
that would have just taken him off, because that was the first thing. What are you doing?
Right.
Because he was afraid. So I explained all that and educated her on that. And that helped her deal with him a little better. And in those situations where it's hostile, not a dementia patient, but it's just hostile. And I've been there, done that, where so many people have told me, you know, because of who I am, that they don't want to work with me, that they don't like me, they don't value me, they want another worker. Because I live in a community where it's not a lot of people that look like me. And so I let them express that. And then I explain to them that I'm hired by this company, and I have the education and experience to be here. And for whatever reason, you were chosen to be on my caseload. I was chosen to be your social worker. I understand how you feel. Not understand meaning agree, but I comprehend, because I can comprehend English. I understand what you come from. So now that we've got that all out of the way,
right,
can we really get to work on getting your children back home to you? I mean, that's just kind of how I put it, because
right.
The issue at hand is not that I'm not going to minimize that you don't like me. And every single time I call, you're like, oh, why is that N-word calling me? You know,
Mm-hmm.
that you may say that to your family and friends. You may say that to my face. And that's your business to do. But the reason that people pay me to be here
Wow.
is to work a reunification plan with you and your children, so your children can go back home, so they can get out of this foster home, so that my tax dollars can quit paying for them to live there.
Wow.
So that's the goal. So now that we got all of that out of the way, can we get to work? I mean, I've had to say that to people, and they're like, okay, yeah, you know. And so some I've won over and some I haven't. But the bottom line is, when I don't win you over, it's still about the work that I need to do for you.
That's good. That's good. Now that take a strong. I'm sitting over here. I'm like, Lord, can't nobody tell me, they done let me out. Let me out of well. See, I done been went down. But that is great self-control. That's a great example of self-control. And it's sad that in our culture, we have to constantly educate people that we're no longer there, that we have evolved. And it was something that you said before our interview series about belonging. Mm-hmm. Can you speak to some more about that? Let's continue that conversation so our listeners can have a listen about belonging. I think it was so powerful.
Well, I have this belief, and it's just my own personal belief. And I heard it in a training not too long ago, and I thought, that's my belief, though, that I belong everywhere.
Right.
Because of the job that I do for my career, and just because of my own personality, I feel I belong in all spaces. I belong everywhere. So wherever I am, I'm going to deliver what I have to deliver.
Right.
So if I'm in a space where the people look like me, then I'm going to deliver what I need to deliver.
Right.
If I'm in a space where people don't look like me, I'm going to deliver what I need to deliver. I like being in all spaces because I can learn from all those spaces and then take it back to the space that I'm in, whether they look like me or whether they don't. So when I encounter people that need that information, that's kind of my laser focus. You know, I'm not a doormat though. So I let people know, how I want to be treated.
Of course.
And what you're going to continue to say to me and what you're not going to continue to say to me while we're in this working relationship. Because the bottom line is, I'm a human service professional, meaning I'm providing you a service. And so emphasis on you, the service.
Right.
Because I don't need this service at this time. Like if I'm helping you acquire Medicaid, for example,
Mm-hmm.
I got health insurance.
Right.
I'm not trying to get health insurance for me. I'm trying to get health insurance from you. So
Right.
if I'm asking you this question that belongs on this application and you are acting pissy with me about it, we're going to address that first.
Right.
Because this is one way you're going to continue talking to me if we're going to get this application done. And if by chance you feel that I'm not the one to help you because you're looking at the fact that I'm a woman or you're looking at the fact that I'm Black, then that is on you to go to my superiors and talk to them about getting someone else. And why? Because I'm not going nowhere. The people pay me to come here to help you. And so you're it. Now, if you don't want me, then it's up to you to take that initiative and go get someone else. And be prepared, though, because if they tell you, ooh, she all we got in the hospital, she's the only one that we have, then you're going to have to, you may have to buck up and come back to me, and that'll be okay. Because, you may have just cussed me out, told me you wanted my supervisor, you want a different worker, this and that, and the other. And as you're walking down there, I'm thinking, they're going to tell this person that Elaine is all we have. And they're going to send you right back to me, and I'll be like, hey, even in this trying time.
Right.
Because people are on edge.
Right.
For good reason.
Yes.
People are dying every single day, every minute of the day.
Yeah.
People are leaving the hospital not in a better condition. We're talking young people leaving the hospital with oxygen. Who does that?
Wow.
We're talking people who are watching their family members die, and they're still saying, "You ain't got no COVID."
Oh my goodness.
And they're getting younger and younger and younger. And people who, as I'm talking to them, they are cussing me out because I got a mask on. If you take that mask off, I can't hear you. I'm like, okay, well, let me speak a little louder. Well, come closer. No, don't do that. But I'll speak louder.
Right.
Or you know what I will do? Let me go all the way down the hall. I'll take the mask off and then I'm going to yell it. But then I can't really do that because then that's getting your health information out to.
Right. Right.
So then that's when somebody will probably then admit to me they can hear me just fine through that mask.
Uh-huh.
Because they realize I'm not going to take it off for my safety and for theirs.
Wow.
So it can get trying even with coworkers. I mean, there are people who, have differing opinions on, the disease, on the treatment for the disease and everything. And the virus, and everybody's entitled to their own opinion. And, everybody has to just do what they think is best. And what I think is best is, shelter in place as much as possible. In my hospital, I handle business through the technology that have been created. Isn't it something? This technology was created even before the pandemic.
Yes,
we were using our iPhones for FaceTime and on Zoom calls and all this other stuff before the pandemic even hit. And so now it's just heightened. And I remind people of that sometimes. When they say, I don't want to talk to nobody on no phone. Like, but your grandchild live in Oregon.
You talk to her.
And y'all talk to y'all grandchildren on the video every week.
Yeah, that is true.
So why is this different? And why are you yelling at me that you're talking to me on the phone or through the Zoom?
Wow.
When you've been doing this with your grandchild since Alexa came out. I mean, so Child, that's and sometimes and when I say it like just like that to me, child, please, and and then they'll laugh and be like, yeah, you got a point. I'm like, I know.
What I love about you, you have such a humorous personality that you don't let the job dictate how you respond. You dictate how you respond. And going through all the challenges and stuff and seeing those young people rolling out the hospital with the oxygen tanks, I know it's getting costly, not just for the hospital, but for the patients.
Yeah.
But they can't go back to normal of working or even earning revenue to take care of that. So as a social worker, how are you helping those individuals when you're adjusting and planning for their after? Because I know a lot of them are having to be discharged because y'all running out of beds.
Yeah, well, it's especially challenging when people don't have health insurance.
Right.
And fortunately, in my hospital, we have a team of Medicaid analysts.
Okay.
That I can refer people to while they're in the hospital. If they come in self-pay, that I can refer people to that analyst. They can initiate the Medicaid application with them over the phone.
Okay.
And if they meet the income guidelines, they can start them on Medicaid right then.
Wow.
And the fortunate thing about our healthcare system with Medicaid is that somebody comes in the hospital today, they may have come through the emergency department. I'm not back at work until a couple of days from now. They have all racked up all these bills before I get there.
Wow.
They get qualified for Medicaid, but Medicaid pays retroactively 90 days.
Wow.
So it'll cover those bills.
Wow.
And so now, depending on what state a person lives in, there may be more coverage than others. Some may cover it 100%. Some may say, okay, I'm only covering your, couple of days or whatever it is. But at least there is some coverage there if you're income eligible. When you're not income eligible, that's when we got to get creative.
Oh, wow.
I've known people having to liquidate some assets that they've had to pay for their care. And that can be very frustrating. Man, I'm saving that for my retirement. And I just have to talk to people in terms of, but if you don't get to your retirement, then it's moot anyway. So look at it in terms of you have something set aside.
Right.
That some people don't.
Exactly.
And you can liquidate this and then take care of your care. Sometimes when I know that that's not an option for people, I just try to get them to focus on, you never know what's going to happen by the time that bill comes. You might have gotten a different job and now you can pay the bill. You might have a relative that says, hey, you know what? I'm going to dig into my 401k and I'm going to give you this to help you out. You just don't know. You might even qualify for a payment plan with the hospital. And you got this big, $100,000 bill.
Right.
And the hospital says, okay, based on what you make, even if you don't make nothing, this is what we're going to have you pay every month. So this is no different than you going out to Macy's and maxing out your doggone credit card. And then you coming back and Macy's say, give me $20 a month. Now, how are you paying $20 a month on a Macy's credit card that you done racked up $5,000 worth of Macy's and you get to pay $20 a month? So now you finna cry that you got this big hospital bill, but then the hospital wants you to pay. And then I had a lady say, I didn't even think about that. Because my American Express, I got $10,000 limit. I said, there you go. Wow. And what do? Every month, you make sure that you pay that. So I may have to connect people with financial planners.
Right.
This one man I connected with a financial planner. I also connected him with a rep payee because it was too stressful for him.
Thank you for listening to Courageous Conversation with Teresa W. Gamble, bridging generational gaps through active listening and action-oriented changes.